Health Tidbits with Dr. Kohli. Hi, it's Jenny D. And we are talking today to Dr. Kohli, of course, from 9 News. She's an expert there and also an expert at Cherry Creek Heart. She's accepting new patients. Let's talk a little bit about eating smaller meals better. So where did the concept of eating like 3 meals even originate?
It's a complete man-made fabrication.
Awesome.
So it's all cultural and advertising and historical. The way that our bodies actually evolved, Jenny, was to be hunter-gatherers, feast or famine. So we eat and then we don't eat for a couple of days. And that's really how our bodies are sort of engineered, so to speak. In the Middle Ages, people started eating sort of one big meal a day. And the ones that were wealthier started adding a breakfast to show off that they're, have ability to eat more than one meals. And then it was really the Industrial Revolution when Americans went to work and there was a schedule and we got a lunch break. That's when we really started doing that 3 square meals a day, breakfast, lunch, and dinner. And so really our bodies haven't evolved that way, but that's how we end up eating.
Yeah.
And it's really raised the scientific question of whether we should change the way we eat, not just, how much we eat, but when we eat, how many meals a day we eat.
And how, do hormones play into, our appetite, how hungry we feel?
It's interesting. A lot of it is regulated by hormones. So we have the satiety hormone, which is called leptin. We have a hunger hormone that's called ghrelin. And then we have hormones that get released after our gut gets stretched or full.
Okay.
And that also kind of is a communication to our brain when we're hungry or not. But leptin and ghrelin can follow circadian rhythms. So when we're sleep deprived, for example, you might notice that we have more food cravings, especially for more processed types of foods. And that's because our hormones get disarrayed. That's right. Macaroni and cheese and pizza. That's what I used to have post-call.
Oh, yeah.
Yeah, because you stay up all night and then you're like, I need to reward myself with something really unhealthy.
Yes.
So, but that's not just me being bad. That's my biology. That's my hormones getting disarrayed by the circadian rhythm. Or, for example, when you travel, you're at the airport, you kind of have a craving because your sleep schedule's messed up for more types of junk food. So what we have to understand is that our sleep, our waking cycles, how we eat, all of that influences whether or not we feel hungry. Now, you'll notice if you're traveling overseas, you get hungry at the same time, even if you haven't really necessarily expelled those calories. So if you're sitting on a plane for, 10 hours, after 4 or 5 hours, you will get hungry, even though your body hasn't really consumed the calories that you've even already eaten for breakfast. And that's, again, those hormones kind of kicking in.
And so, does eating smaller meals more frequently, does it help with the metabolism? Does it help you to lose weight?
Yeah, so this was a myth. And initially, some of the studies suggested that, okay, you're revving up your metabolism more because every time you eat something, you have to kind of rev up your metabolism.
That's what everyone said. Yeah, it's like, oh, keep it going,
keep
it going.
Keep it going. No. Okay. Actually, if you control for caloric intake and control for what you're eating, there's really actually no difference. In fact, when you eat a lot of meals, especially as someone who doesn't have great portion control, then you're more likely to overeat. Because if you think about it, if you're eating 5 meals a day, those have to be really, really tiny meals, right? They have to be half the size or less of your normal meal. And if you're still eating a good sized meal 5 times a day, that's actually going to increase your overall caloric intake and end up making you eat more. So they've looked at this for metabolism. They've looked at this for heart disease, for insulin sensitivity, for diabetics, for cancer risk, and really across the board, 5 meals a day versus 3 meals a day is no difference at all to your metabolism if you're eating the right things. So more important than how many times you're eating, it's really what you're eating. So I would suggest that every meal should be pretty high in protein and fiber because those are the 2 satiety types of foods. They keep you full longer, and they're the right types of ways to keep you full rather than what we usually end up reaching for, which is, carbohydrates and processed foods.
And what about the weight loss thing? Does it help?
It doesn't help with weight loss. So the best way to lose weight, I always say, is portion control. So if you're going to eat either 3 times a day or 5 times a day, whatever works best for your schedule, what you want to do is take the amount you normally would have eaten and take away a quarter of it. So I actually ask my patients to fill up their plate as they normally would have. Then I ask them to put a quarter of it back. Then I ask them to wait 30 to 40 minutes after they finish that first plate before they reach for seconds.
Okay.
Because it takes about that long for that satiety signal to get to your brain. And you're really supposed to stop eating when you're 80% full, but most of us keep eating until we're full, which by definition means we've overeaten. So the best way to really lose weight is it's a math problem, in versus out, decrease how much you're putting in, and then increase how much you're putting out. Now, what I don't want people to do, and they looked at intermittent fasting recently, and a new study just came out saying intermittent fasting is no better than just calorie restricting.
Yeah.
So I don't want people to starve themselves for extended periods of time, because sometimes what we do, we'll wake up and we'll say, I'm skipping breakfast today as a way to reduce my portions. But what that does is it turns the volume up on the ghrelin, which is that hunger hormone, and then you eat more at lunch. And the way that you eat it, the way that your body metabolizes it is different because you're more hungry going into that meal. So I would, again, rather that you have 3 smaller meals and stay full all day long, especially if they're high fiber, high protein meals, rather than starving all day and then eating a really large meal.
So when is it that you would eat like the larger meal? Like when do you think that's ideal?
It's funny because they've also looked at this. There's a science to this, and you eat breakfast like a king and dinner like a pauper. So really in the morning is when our metabolism is the highest, and we do it opposite. Again, a cultural phenomenon, right? Because we have time in the evening, we sit down, we have this big meal in the evening when our metabolism is slowing down and it's time to go to bed and we're not expending energy. So I really do like to front load my calorie heavy meals and try to keep dinner lighter. So I like to say that breakfast and lunch should be your 2 heavier meals and dinner should be a much lighter meal. We should invert the way that we're eating. And what it also does is for people who have heartburn or reflux, this can be really helpful as well.
Because you're not having that sitting in there while you're trying to
go lie down, and then it kind of aspirates into, and you're moving around after you have it. And so you even prevent the spike that happens in your blood sugar after you eat meals, as opposed to dinner, when we eat dinner and then we turn on the TV and we're just relaxing at home, and then the spike gets a little bit bigger.
A little bit, you're like, whoa.
Yes, exactly.
Well, that's perfect. Well, eating smaller meals, making sure it's a good meal, that's a really good rule of habit if you're working still on those New Year's resolutions. This could definitely be something that helps that. Thank you, Dr. Kohli. Check her out at Cherry Creek Heart. And of course, you can always see her on 9 News.